Hello everyone, a very good day to all of you. Today we are going to talk about vitamin D with Dr. Mo. We will discuss about vitamin D and what are the food that has vitamin D, deficiencies, symptoms, and what is the recommended daily intake and some more other things related to it. Okay, first of all, vitamin D is not a vitamin. Technically, it is a hormone because it doesn't have the main characteristic of vitamins, which cannot be produced by our bodies, but actually vitamin D can be produced by our bodies, not like other vitamins. Yes, it can be produced through natural source, which is from the sunshine. After we get exposed to sunshine, especially the ultraviolet B, it will change one of the precursors of the cholesterol in our skin to vitamin D. Yes, this precursor is we call it 7-dehydrocholesterol. After exposed to ultraviolet B, it will be changed to vitamin D. Then it will be transferred to our liver to gain one pair of hydroxyl group, and it will be called 25-hydroxy vitamin D3. And this is actually not the active form of vitamin D, but this is the compound that usually we check its level to tell whether you have a deficiency or enough vitamin D in your blood and in your body. So the 25-hydroxy vitamin D will be transferred to the kidneys, and in the kidney will gain one more pair of hydroxyl group, and it will be called 1,25-dihydroxy vitamin D, and this is the active form of vitamin D, which will do its beneficial action. So what are the action and benefits of vitamin D in our bodies? The main is to help the absorption of calcium in our intestine. Yes, those who are deficient of vitamin D will have only 10 to 15% of the ingested calcium to be absorbed, while those who have efficient and enough vitamin D, they will have 30 to 40% absorption of that calcium. So it's a big difference. So if we don't have enough vitamin D, means we will have a weaker bones. Yes, we will have a weak bones. So we are easy to get fractured, especially for women who are going to osteoporosis or after delivery or pregnancy. So they will have a deficiency of calcium as well. Okay, what are the other benefits of vitamin D? Actually, vitamin D is important for all the organs of our body, starting from the brain, right up to our heart, to our lungs, as we said, to our bones, to immune system, and to protect against cancer. Yes, it's very important, and it's very necessary to check your vitamin D regularly to make sure you have enough of it. Okay, so what is the levels of vitamin D? So less than 20 nanogram per milliliter considered deficiency of vitamin D. 20 to 30 will be considered insufficient, and above 30 will be enough. Why now we are having a large debate and a large discussion about vitamin D, and lots of healthcare personnel talking about it, and they are focusing on it? Because now we have a very high prevalence of vitamin D deficiency. Lots of study been done in different parts of the world. They found more than 30 to 40% of the population, they are having vitamin D deficiency. Why now it is deficient? Okay, let's talk about the causes and the reason behind its deficiency. Okay, the main cause, not enough sunshine, exposure to sunshine. Due to our lifestyle, now our lifestyle is more to indoor. We are not really outdoor people like before. So from office to home, from home to shopping mall or in your car, so not enough exposure to sunlight. This is one. Second, could be not enough food, which is having enough vitamin D, or not enough supplements. Why I'm saying supplements? Because actually the foods, not much food are having vitamin D. Most of the food don't have vitamin D. So this is unfortunate for that. The main food which contain vitamin D is fish, especially the oily fish and egg yolk. Okay, what are the other reasons for vitamin D deficiency? Those who are having a dark skin tone will be more at risk to have vitamin D deficiency. The main reason of vitamin D deficiency nowadays is the lifestyle. They found a very strong correlation between the level of stress, which will increase the level of cortisol. This is a hormone of stress that will have a relationship with the vitamin D level. The more cortisol, the less vitamin D we have. Another important reason for vitamin D deficiency is the use of sunscreen. Anything above 30 SPF will cause a reduce in the absorption of the ultraviolet B, and that will reduce the production of vitamin D. And actually this is kind of dilemma, because the healthcare professionals will advise the people not to get exposed to sunlight too much, because that will cause lots of skin damage. It will cause an early aging of the skin and even can lead to cancer of the skin. So you need to know how to get enough sunshine exposed in a way that not to lead to a skin disease or cancer. So it's kind of dilemma. You need to know how to balance the sun exposure and also not to hurt your skin. Actually, most of the food doesn't have vitamin D, and that's why most of the people nowadays suffer from vitamin D deficiencies. So how to get enough vitamin D? Okay, plus using the natural resources from the sunshine, and as we agreed that our lifestyle nowadays is more to indoor, so definitely most of the population suffering from vitamin D deficiency. So we are recommending to use vitamin D supplements, and the recommended daily intake nowadays is 1000 international units per day. Last time in 1997 it was only 200 international units, and because after checking there is lots of people suffering from the vitamin D deficiency, so that's why now they increase the recommendation daily intakes. To make it clear for you, as a comparison, one egg yolk contains only 20 international units, and our recommended daily intake is 1000. So can you imagine? Even we eat food rich with vitamin D considered, but still we are not getting enough. Plus not enough sunshine exposure, so definitely we are facing a vitamin D deficiency. Let's talk about the vitamin D deficiency symptoms. The main symptoms of vitamin D, we will have a weak bones, so we might have pain in our bones, we might get easily fractured, any fall, any touch or accidents will cause a fracture in our bones, especially to the woman at the age of menopause, so they will have a double burden of vitamin D deficiency and calcium deficiency and easily can get fractured. Another symptom of vitamin D is our moods will not be stable, so we will have a mood swing, or we might have even some kind of depression or restlessness. Okay, it will affect on our focus, it will affect on our level of alertness and our focus and our performance as well. Vitamin D, it can affect our immunity and can lead to many diseases, easily can fall sick, so it will boost our immune system. If we don't have enough vitamin D, we will have a lower immune system and we are more prone to get infections. Vitamin D indeed have some relationship with diabetes. They found in a study those who are deficient with vitamin D, they are more to have a diabetic mellitus risk. Okay, vitamin D, it can even lead to cancer. Yes, they found a relationship between prostate cancer, intestinal cancer, and vitamin D deficiency. Why vitamin D is so important? Because they found vitamin D receptors are found all over the body, in our thyroid gland, in our bones, in our brain, our intestine, prostate. So the receptors are there, and it will do lots of function and activities there. It will boost our immune system. It will boost our vitality. So it's really crucial when we have a vitamin D deficiency. We will end up with many consequences and with many diseases. So please go and check your vitamin D and to be treated this deficiency properly. How to treat vitamin D deficiency? If it is confirmed you are having a vitamin D deficiency, which is less than 20 nanogram per milliliter, it is very important to take the high dose vitamin D, because if you start to take the recommended daily intake of 1000 and you have a vitamin D deficiency, actually it is not enough for you. So you need to have the high dose vitamin D, which is 50,000 international unit once a week for 8 weeks, and after the 8 weeks you start to take the recommended daily intakes of 1000 international unit for 3 months. Then you check again your vitamin D level to see how is it back to normal or not. Most of the time definitely will back to normal, and you will feel much better in terms of mood, concentration, health, wellness. You will feel definitely healthy and more cheerful. Okay guys, so as a message to take home, it's very important to check your vitamin D. So check yours, check the vitamin D of your parents or your loved ones to make sure it is at the normal level. So it's important to discuss with your family doctor about your vitamin D and ask to do the vitamin D blood test checkup, and then if it is deficiency, to take the vitamin D treatments or vitamin D supplements to get it back to normal, to enjoy your life with a better health and to be always positive and healthy. Thank you all, and hope you get benefits from our talk. If you have any question, please write for me, and it's my pleasure to reply and respond to you. Please support us with a like, subscribe, and share to your loved ones. This is Dr. Mo, and hope to see you all again with the best of health.
Okay guys, with this such weather, do you think you could get enough sunshine to get enough vitamin D from that source? Write for me if your place having such weather or environment. Thank you guys. Please share, subscribe, and like. Write for me in the comments if you have any question or anything. We will support you definitely with that. Thanks, and see you in the next video. Stay always healthy.
Patient? Okay, call please. Thank you all. Thank you all.